If you've heard your physician mention multimodal treatment, they're referring to the use of multiple types of treatment in combination rather than relying on just one approach. Your multimodal treatment plan could include any mix of surgery, chemotherapy, radiation, or immunotherapy. For mesothelioma, multimodal treatment often achieves better outcomes than any single treatment alone. But it's also much more complex, more burdensome, and not appropriate for everyone. Today, I want to explain what multimodal treatment is, why combining treatments can be more effective, what typical combinations look like, and how to decide if this aggressive approach is right for you. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I am not a physician, and this is not medical advice. But having a good understanding of multimodal treatment will help you better evaluate comprehensive treatment options. Now, let's start with why combining treatments might work better than single treatments. Different treatments attack cancer through different mechanisms. Surgery removes bulk tumor, which are visible masses and nodules, while chemotherapy kills rapidly dividing cells throughout the body. Immunotherapy helps the immune system recognize and attack cancer, while radiation kills cancer cells in targeted areas. Using multiple approaches attacks cancer on multiple fronts, all at roughly the same time. The point is that different protocols can work synergistically. Their combination is more effective than the sum of their parts. For example, surgery might remove 95% of your tumor burden, but it leaves behind microscopic disease. Chemotherapy can then eliminate those residuals more effectively than if surgery hadn't been part of the process and the full tumor burden had been present. Before I go on, because there's a lot to cover, I want to take a break and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, let's discuss what multimodal treatment looks like in practice. For peritoneal mesothelioma, the most successful multimodal approach is cytoreductive surgery with HIPEC, followed by systemic chemotherapy. First, the surgery removes all visible tumors and delivers heated chemotherapy directly to the peritoneal surface. Then, after recovery, patients receive several cycles of intravenous chemotherapy to kill any remaining microscopic disease. Some specialty centers employ protocols that include chemotherapy before surgery as well. This combination has transformed peritoneal mesothelioma outcomes, with 5-year survival rates as low as 50 to 75%. For pleural mesothelioma, multimodal approaches might include chemotherapy followed by a pleurectomy decortication surgery, followed by treatment with radiation. The chemotherapy starts by shrinking the tumors before the surgery, then the surgery removes as much disease as possible, and then radiation targets the surgical area to kill any microscopic disease that remains. Other combinations that are commonly used include chemotherapy plus immunotherapy given together or sequentially, or surgery followed by chemotherapy and immunotherapy. The specific combination will depend on your disease stage, your health, and the specific center's protocols. The timing and the sequence of treatments matter. Neoadjuvant treatment, which might be chemotherapy, immunotherapy, or both, given for several cycles before a planned surgery, it's given to you to shrink the tumors and make them more resectable, meaning operable, while adjuvant treatment is given after surgery to eliminate any remaining microscopic disease. This prevents or delays recurrence. Concurrent treatment means giving treatments simultaneously. For example, chemotherapy and immunotherapy together, or chemotherapy during radiation. Sequential treatment means giving treatments one after the other. For example, surgery, then chemotherapy, then radiation in sequence. What are the advantages of multimodal treatment? In carefully selected patients, multimodal approaches achieve the longest survival times because the combination attacks cancer more comprehensively than any single treatment. Some patients have achieved long-term disease control with multimodal treatment, and this is particularly true for peritoneal patients receiving surgery plus HIPEC plus chemotherapy. What are the downsides? Multimodal treatment is more intense and burdensome. Cumulative side effects from multiple treatments can be significant, and recovery time is going to take a lot longer, months of treatment and recovery rather than weeks. Plus, not everyone is healthy enough to tolerate aggressive multimodal treatment. The approach requires commitment and resilience from patients and their families. Coordinating multiple treatments requires specialized centers with multidisciplinary teams. It often means traveling for care. So, who should consider multimodal treatment? Patients with early to intermediate stage disease who are surgical candidates are the ones who benefit the most. Multimodal approaches are most effective when surgery can remove the most visible disease. And patients with good performance status, which means they're able to care for themselves and perform normal activities, they're the ones who tolerate aggressive treatment better than those who are frail or debilitated. Younger patients with few other health conditions or comorbidities are better candidates than older patients with multiple. Epithelioid cell type responds better to multimodal treatment than sarcomatoid does, and patients treated at specialized centers staffed by experienced multidisciplinary teams generally achieve better outcomes. Who might not benefit from multimodal treatment? Patients with advanced stage disease where surgery isn't feasible, they might be better served by systemic treatment alone. Patients with sarcomatoid cell type might not benefit from surgery even if their disease appears to be localized. Patients with poor performance status or serious health problems may not be able to tolerate the rigors of multimodal treatment. For these patients, less aggressive approaches that are focused on quality of life may be more appropriate. So, how do you decide if multimodal treatment is right for you? Start by getting evaluated at a specialized center where multimodal approaches are offered. Understand what the specific proposed treatment plan involves, which treatments in what sequence over what time period and with what recovery periods. Ask about outcomes. What are the survival statistics for patients like you receiving this multimodal approach at this center? Ask about quality of life during and after treatment. How will you feel during the months the treatment will take? What's recovery like? When can you resume normal activities? Consider your goals and your values. If maximizing survival time is your primary focus and you're willing to endure significant treatment burdens to pursue that end goal, multimodal treatment might align well with your wishes. But if quality of life and minimizing medical interventions are your priorities, a less aggressive approach might be a better option. Discuss all of this with your family members because multimodal treatment will affect them too. Months of treatment, recovery, and caregiving place significant burdens on families. Important questions to ask your doctor include, why do you recommend this multimodal approach versus a simpler treatment plan? What's the evidence that this combination works better than single treatments? What are the alternatives? What's the timeline for completing all treatments? What's the cumulative burden of side effects? What happens if I can't tolerate one component of the plan? Do we abort the whole thing or do we adapt? Understand that multimodal treatment requires flexibility. The initial plan might need adjustment based on how you respond to each component, what side effects you experience, and how your disease behaves. The medical team needs to be willing to adapt rather than rigidly sticking to a protocol that's not working for you. So, to review, multimodal treatment combines surgery, chemotherapy, immunotherapy, and sometimes radiation to attack mesothelioma through multiple mechanisms. This approach often achieves better outcomes than single treatments, particularly for peritoneal disease treated with cytoreductive surgery, HIPEC, and chemotherapy. The benefits, they include longer survival and more comprehensive disease control. The downsides include a greater treatment burden, cumulative side effects, and longer recovery. It's most appropriate for patients with early to intermediate disease who are in good health and who have access to specialized centers. You can visit mesothelioma.net for more information about multimodal treatment approaches, or you can call us at 1-800-692-8608 or use the live chat feature on the website to work with one of our patient advocates immediately. As for me, remember to post your questions below, and I'll see you next time.